The body cannot live without the mind. And can the mind live without the body? We certainly hope so. But if the mind and the body work together in harmony, we can remain at the center of calmness. Good evening and welcome back to another episode of Center of Calmness. And tonight we have with us Dr. Allen. Super stoked to have you here, Dr. Allen.
DK, thank you so much for having me. It is an honor to be on your show. The Center of Calmness, that opening was awesome. I feel so much more calmer, actually.
That's the goal, right? To bring folks into better control and the ability to manifest calmness any place, anytime. That's the overall goal. And we explore lots of different solutions and methods for doing that. So when you mentioned that you're into the body-mind connection aspect and offering those kind of solutions, I was super interested in what that is. But before we get into that, I just wanted to ask, I noticed you're from New York City, actually. New York City was kind of a stressful place for a while, wasn't it?
Yeah. I don't know if you heard, but there's this COVID thing going around, and we got annihilated. We were the first ones, and things are not doing so well around the world, but we are still the champions, I think, as far as how bad things were. It's not worth getting into like deaths and whatnot, but things were pretty horrible back. And I am not only a member of society, but I actually had COVID myself for a couple of days. So that it is not fun. But
wow.
It was pretty rough.
I'm glad that you're on the survivor list for sure. That's awesome, and it's super tragic that the world and it's the first time I've seen the entire world go through a pandemic of that nature. And my hearts go out to the folks that are affected, of course. What I wanted to ask, especially though, is that with New York being on the cutting edge, on the leading edge of that, at least from the American standpoint, how is the city doing now?
It's empty. They're going to say how great things are. The city is doing fine as far as numbers go, but I live on the Upper West Side of Manhattan. It's empty here. Nobody is here. The restaurants are shutting down. Gyms are not open yet. You cannot do indoor dining here. Things are fine for now. But when travel starts getting back up and then winter, that you can't eat outside. I mean, the only way you see anybody or anybody here is just going to these outdoor restaurants or outdoor spaces, or if you're lucky enough to have a rooftop, you can do that too. It's a very weird vibe, and Manhattan is the best place on this earth because of the food and the art and the culture and everything. And right now, It's just overpaying for small apartments, and there is a mass exodus from the city, and my days are numbered as well here. I'd be very surprised if I was here in another year.
Well, that's crazy, and probably more than we can cover here in our short segment. But wow, that's got to put the stress level up to a whole other point, right? Now that just increases the need for your solution. But given that folks aren't able to really meet in the such a social distancing aspect to everything these days, how are you able to apply your craft?
Well, my craft, I'm a doctor of physical therapy. And when you talk about body and mind, I'm an expert of the body. It's plain and simple. Muscles and bones is what I do. I have worked in every setting for a physical therapist, from hospital, post-op day one, cardiovascular treatment, heart surgery. I've done rehab. I've done home care. I've done it all, and my specialty is outpatient orthopedics. So most of my patients are complaining about pain. Not all, but pain. Whether it's from an accident, whether it's from surgery, whether it's from posture. Pain is one of the number one things I treat, and that's my goal, is to get patients get better. But the truth is there's a huge mental component, specifically with low back pain. One of the number one leading things in this society of days missed from work. They say something like 80% of people will end up missing a day of work due to low back pain. And there's a huge mental component to it. And then one of the most measurable tests that we have in the physical therapy world, it's not even something that you can measure with strength or range of motion, but it's something called the Fear Avoidance Behavior Questionnaire, FABQ. And what that is people have to rate how afraid they are to do something that might cause them to have more pain. It's very reliable, high sensitivity, high specificity, but when it comes to the mental component of getting better, people say they want to get better, but you really have to believe it. And it sounds a little cheesy, but there's so much truth to that. Is some people like having the excuse of, oh yeah, well, I'm a couple pounds overweight because that knee injury a couple years ago. And when you can give yourself an out, that's not a good thing. But at the same time, if you're not mentally tuned in to improving and getting better, you will never get back to 100%. For me, I say my patients, I want them to be 110% because most people are not running around at 100% anyways.
Of course. Now, what's curious to me though is that I would expect that the processes that you're either applying to your clients, your patients, or what you're instructing them to do are proven. They're repeatable, sustainable processes. Are you saying, if I understand you right, are you saying that the clients or patients that follow the process but don't have the mental fortitude and the commitment to be healed actually won't be successful?
Sometimes, yeah. I mean, that is what it's about. And when it comes to the processes of getting people better, yes, my hands, my modalities, the exercises, yes, everything is replicatable. A monkey could do my job, really. The hard part about doing any type of job, and my mom worked in a dental school forever, and her boss who did root canal said anybody could do a root canal. It's dealing with the individual patients and the individual problems, and that's what makes a good clinician. Getting a doctorate is not hard. You go to school, you do the tests. It's work, but it's not that hard. Being a good clinician is treating everybody individually and recognizing the different barriers that prevent them from achieving success. And I wish we got more mental, psychological training, but it's kind of, you can't do it. You have to go through the experience. And I've been a doctor now for 12 years, and I've seen everything, and you start to see patterns. You start to see why people act the way they will, and a mental barrier, which is I think the term you use, which is perfect, great way of describing it. Tuning into that is so important. And I can't refer my patients to a psychologist. Some of them should. Some of them are psychologists. I can't say, okay, you know what, you have a knee pain, you have this. If you don't go deal with your other issues, then you're never going to get there. So I'm the one that has to figure out what that is and how to get them better without making them feel bad. I mean, nobody wants to feel bad about their struggles, but if you can tune into what it is that they're struggling with and how you can get it better, their physical achievements are easy. They get so much easier when you can work through whatever it is. A lot of times it's just fear. It is, I'm afraid. And I see a lot of patients that are Spanish speaking, and, my Spanish is a little bit, but, when they're sitting there saying, no me caí, like, I don't want to fall. And it's like, I have you. Right. I'm here to help you do it. And I build them up. I have patients. Now, I'm a young, healthy, I used to play hockey. I'm a super athletic person, but I start off working with geriatrics, and we go very slowly because I give them little successes of, we're going to do steps. No, I can't do steps. No. We're just going to do a 2-inch step. I can't do steps. Look at that step. It is 2 inches. You can do this. And then they do it, and they're like, wow, I could do that. And I go, all right, now let's try the 4-inch. And then they struggle a bit. So then we figure out where it is. And I would rather have my patients come in on day 2 with that was way too easy for me, let's get harder, than have them come in and say, I couldn't get out of bed for 3 days. Whatever we did was way too much. And finding that in there, and I think tying into what we're talking about today, is connecting the mind with the ability and the physical with the ability. And not everybody, but if you're missing one of those, you can't get results. And then you look bad. And I want to be the best physical therapist I can be by tuning in on all these little things that they're saying and doing. And you finally realize, oh, that's what's going on here.
So what I'm curious about, the mental barriers, as you put that, and what an efficient way to express it. Do you find that those mental barriers are obvious even from when you get the first questionnaire back from them, or do you have to work with them for a bit and allow those barriers to be expressed as you try to get them to accomplish the moves that you're trying to get them to do?
It definitely falls in both categories. I have people who call me for their first visit. I pick up my own phone and I talk to them, and I can almost tell you that it's the first evaluation. From the first couple sentences on the phone are going to be different. I know there's going to be, I don't like saying difficult, but just more to work with, we'll say. And versus the other people who call me and they're like, I don't know. I mean, I've had patients come in and they just say, I'm not even sure why I need PT anymore, but the doctor wants me to do it and I'm off work, so I might as well do it. They're a little bit easier to deal with. But I know from the first phone call, usually there's going to be something. This person is going to be a little bit more effort during my day. But then, yeah, DK, sometimes people come in and they seem as normal and willing as you or I, and then you start to realize there's more to the puzzle. You start to realize that I take for granted what I know. Most people don't know what muscles are where. I mean, again, I have done so much schooling. I've been a doctor for 12 years. When you say hamstring, quadricep, calf muscle, groin, deltoid, bicep, these are second age. These are my ABCs. But some
Right.
people don't. Some people don't know this stuff. They really don't. And I think I heard the number the other day. Only somewhere between 14 to 18% of the American public exercises. So that's a big number. Those are young, healthier people sometimes. So I have to start from scratch and build them up and figure out what they know, what they don't know, and how we can get them to where they're going. And the miseducation or misunderstanding of physical exercise is crazy. I mean, remember back to the Suzanne Summers and the Thigh Master and 8-minute abs, and this is not exercise. This is not real. The Instagram models are not real, and the product out there,
Right.
it's not real. So we have to start with you and hard work. Work. I say this to every one of my patients. If you do the work, I guarantee you will make improvements. You may not run the New York City Marathon this year, but you will 100% make improvements. And when they kind of hear that, they go like, wow, okay, that's good. I can work with that. I'll do the work. He'll do the work. He'll tell me what to do. And we meet somewhere in the middle. I've never had a patient not make some improvement as long as they tried.
Excellent. So yes, I'm sure that you can bring them mentally and with their mindset through to the willingness to engage in physical therapy and exercises and all that. Now, what happens next, right, when they run into that barrier that's almost subconscious, right, where they really have to face that fear and move past it?
Well, they either need to adjust their goals, change their mindset, or maybe just give in. It's facing your fears is so big. And I have things I'm afraid of. And, public speaking, by the way, number one thing out there right now, still the number one
Right.
all-time champion. And
Yeah.
you got to face your fears. You got to get through it. So when a patient has struggles, and we have to meet somewhere in the middle. They say they can't do it. I say they can. And kind of the example I gave before is we either need to start lower or we need to adjust what the goal is. And I work with an elderly population on the Upper West Side here. And sometimes you have to realize now, staggering number, physiologically, you peaked at age 25. So that was a while ago for me, and you look pretty young, so good for you. But the people who are older and they come in, you have to adjust the goals. It's simple as that. And every note I write is individual. I do not copy. I do not paste. At treating as a clinician, you should be treating everybody, one, like they're a loved one because they're a family and you should treat them as such. And two,
Right.
we don't label them. It's such a sin in my world is you call people by their diagnosis, which is rude. It's like, oh, I got a left hip later. I got a right shoulder in the afternoon. No, that is Frank or Mary or Shelly, whoever they are, and addressing who they are and developing a personal relationship with people. And this goes for any walk of life. When you treat somebody like they're an individual, not the person at Starbucks, when they are Michelle, you get a lot further. You really do. And the connection that you can make with somebody at any level, and that's my message at the end of all this, is connecting on people, being a better person. The golden rule, which we all learned in second grade, is treat people the way you want to be treated. And when you can lock into that, the other stuff opens up. I'm not a psychologist. I can't deal with people's mental problems. But when you connect with them and caring, I work in healthcare, except they might want to rename it to Health Make Money because the amount of care that's happening these days is getting worse and worse. And I'm not saying we need to switch our one-party system or whatever, but when you can care about people, everything else gets easier. I genuinely care. I have bad days when my patients are hurting. I do. But I know what I'm doing, and I let them know that, and they know I'm going to be there for them, and they get better. They do. Because it's the placebo effect, which everybody always thinks placebo effect is this fake thing. It's, oh, the person imagines this. Like, no, the placebo effect means if you give somebody a pill and somebody another one and it was a cancer treatment, it doesn't mean that the patient thinks they don't have cancer. They actually don't have cancer anymore. And doctors who have better bedside manner are sued far less than the ones that are actual better surgeons but are not as nice.
Totally understand that. That's huge. And that actually speaks to a much broader concept of body-mind connection. It's not so much, although it's certainly a major component for the individual, right? That their body and mind are properly connected, and their mind is properly motivated to accomplish the healing. But they're connecting with you as well, right? And they're actually leveraging your strength and intuitively, perhaps through that connection in your relationship, your knowledge, then to develop the confidence to follow the moves, right, and improve. That's huge. Quite a different take and a broader take on this subject. So, what would you say overall, outside of the relationship, the caring, the heart connection that you're able to make with your patients, what helps them heal faster than anything?
Discipline and compliance with what we're doing, because I'm the physical part of this. So yes, breathing gets more oxygen. Oxygen goes to the muscles. Muscles then relax. Muscles perform better. Stretching leads to better function. All that stuff is physiology, and most of us are built the same. You know, the mind-body connection I always equate more to like kind of like yogis. It's been around forever. People doing yogas is the more in tune you can be with your body, with your muscles and everything, you'll be better. And I do think that does work. And you know, I just know for people, it's trusting the process of, if you can find a good clinician, which I'm not saying that I'm the best clinician for everybody. I have some patients where it just doesn't work. And then I have other patients that I was the perfect match for them. But when you have somebody that you trust, and trust is so important, is knowing this person is not going to hurt me, because that's what we're all afraid of. I mean, I'm always afraid when I go see somebody new, some dentist or any doctor. The first thing, and the first rule, by the way, of the Hippocratic Oath as a medical professional is do no harm. Yet the malpractice lawsuits are not slowing down anytime soon, and people get bad information, and that's bad. So when you have somebody you trust and you can just put the ball in their court and say, all right, you tell me what to do. Like, I am an exercise professional. I couldn't know any more about how to exercise. I like going to a gym workout where they tell me what to do, because I trust that my instructor knows what he's doing. He knows how to adjust the workout, and I can turn my mind off and allow my cup to be filled up. That's the analogy they say. It's just take it in. And as somebody who's thinking all day long, I want to know that I can trust people and they're going to give me the best instructions, and then I get the best results.
That's really cool. So that would bring up then my final question for this segment here. And coming from my own personal background, where I actually come from a background, even though I'm not exhibiting it now because I've overcome it, but coming from an anxiety background, a lot of anxious people are very reluctant to seek treatment for an issue that they know they have, that they know is serious. What would you recommend to anyone in the audience out there that just needs to get over that hump and seek your support or the support of a clinician like yourself, just to get things started and to get on the road toward recovery?
Yeah, I would say do your research. Most people the doctor gives them a list. They pick from the list. They go from there. They get passed around. When you're going to see somebody, what's the thing the first impression that you have is usually the right one. When you walk in somewhere and, hi, my name is, and they're like, give us your cards, sit down over there. It's like, whoa. This is not how I want my experience to be. Getting back to the golden rule. I treat everybody the way I wanted to be treated. When you're on the other side of it as a patient, you really experience that. Most people have injuries that they've been waiting to deal with. If you can then take care of yourself, you get one body, and when that shoulder's not working right and it gets worse and worse and worse, then something else goes, then you have problems. I see it a lot kind of getting back to back pain. Most of the time patients I have with back pain, it's because there's something else wrong. Their knee was too weak, they're too tight, whatever it is the cascade of dominoes gets worse and worse for you, and you get one life. You do not want to be a cripple at some point. You do not want to be feeling bad that you can't participate in something because you have a physical ailment. So if you can do your research, develop a connection with somebody. There's no shame in going somewhere. It's kind of like a date. You know what? Right. I think that you were really nice, but maybe this isn't the right fit for us. But when you talk, and any clinician that you see should be willing to take a couple minutes to sit down and chat with you. You shouldn't waste your whole first visit talking and getting to know different things and screening them. But there is a process, and God bless the internet. The information is out there. Yes, people write bad reviews, but for the most part, when you see a restaurant and everybody has commented that the chicken parm's no good, don't order the chicken parm. But when you it's the truth. But when you can go on there and see other people that say, I went and saw Dr. Smith and he was very nice. I saw Dr. Smith. He was short, but he knows what he's doing as far as the time. And then you learn, and there's so much information out there. I've been guilty of that. I've been guilty of a recommendation. Then you go see somebody and you're like, you know what? This wasn't the right fit for me.
Understand, right? And that it's right back to that human connection where you can develop that trust and leverage that as part of your healing process. It's so huge. That's awesome. Well, you've shared some super valuable insights with our audience here today. I really appreciate that, Dr. Allen. I just wanted to pop up your info quick in case anyone would have any follow-up need for questions or further support. I just show that here. Dr. Allen's information, breakawaypt@gmail.com. So I just once again want to say thank you, Dr. Allen, for joining us here today at the Center of Calmness. And you can always find me here at the center.
Thank